You're watching HuffPost Live. I'm Nancy Red, and you used to have to drive to the therapist's office to lay on someone else's couch to get your deepest, darkest thoughts out. But now you can speak to your doctor from the comfort of your own home. That's right, more and more people are signing up for online sessions with their mental health professional via webcam. But does screen FaceTime have the same effect as meeting face-to-face? Joining us to discuss web therapy, how it works, and why it's a growing trend, we're joined by Dr. Roy Schoenberg. He's the CEO of Amwell. We also have in our Google Hangout Dr. Jennifer Gentili. She's a Harvard psychology professor and director of behavioral health at Amwell Therapy Associates. And Joanna Ming, who, like me, is a mother of two. Hello, everyone.
Hi.
Hi.
Well, I love this. Dr. Schoenberg, we've actually seen examples of this in pop culture, like in Lisa Kudrow's show, Web Therapy. But walk us through what it's like in real life.
Well, Lisa Kudrow is significantly more talented than all of us. So, it's probably not as
But
as
she doesn't
exciting.
have a PhD, so.
Well, she has other talents that I think are just as impressive. But I think the reality is this, especially in the area of behavioral health, the ability to do this interaction at the time that you choose, at the time that you need it, and at the level of intimacy that comes by being at your own home, and at the level of privacy of knowing that you don't have to schedule an appointment or be in a waiting room that you may find your neighbors or other people around you, I think plays a big role in how simple and accessible behavioral health becomes.
Well, it's interesting. Everything has become simple and accessible. Shopping, online dating, all of these things. Is this just the wave of the future? Is everything going online? Do you see this basically being a replacement for in-office care?
I think it becomes, it's a little bit like the question of whether the Amazons are going to kill the bookstores or whether online shopping at, Saks Fifth Avenue online is going to kill the stores. I don't think it's going to replace the office visits. I think it's going to be another way that allows certain kind of visits to happen that otherwise would have just not happened or get procrastinated or get delayed or in some cases not happen at all, which is really bad in the area of behavioral health. I think we just see online as another channel of healthcare delivery, and one of the places it shines the most is really behavioral health.
Joanna, weigh in here because you actually have sought help online. First and foremost, one of the things, I'm just finding out about this. How did you hear about online therapy?
Well, I'm actually a grad student studying to be a family nurse practitioner, and I was on iTunes searching the App Store, and Amwell happened to come across as being one of the top medical apps. And so I looked into it. Downloaded the app, looked into it, and found that this could be a great opportunity for me to use. I'm a mom of two young girls. My oldest is 2.5, and so we're definitely going through the terrible twos with her. And our youngest is 4 months. So I knew I needed professional help, learning how to help my daughter transition to being a big sister. Just this developmental stage has been really challenging. And so I felt that, this could be a great opportunity for me to see somebody at the convenience in my own home.
Okay, so was it easy? Did you find that you found help at the literally click of a button?
Absolutely. It's easy. You go online, you pick who you want to see. And for me and my husband, we decided to book the appointment at 9 p.m., which was awesome. The girls were in bed, and we sat down on our couch, and we had a visit with our wonderful therapist.
So one of the things, though, that therapy often affords, and then feel free to weigh back in here, is the opportunity to get out, to do something for yourself, to have a change of environment.
Well, actually, for me, it's a lot easier just to be able to see somebody in the comfort of your home, not having to find a babysitter, book that appointment, which is sometimes hard to get in. For me, it was nice just to be able to have a quiet home and meet with somebody on my phone.
I would also say this. I think, especially in the area of behavioral health, sometimes making the first step is the most difficult. Understanding that you want help and that help is accessible, and actually beginning to experience what, the freedom that comes with actually opening up and talking to someone. That is something that a lot of people kind of get stuck. They don't cross that hump and actually begin to experience what can be done for them. The fact that this comes to you maybe allows you to kind of take that first step, cross it, and begin to understand how help with someone who can, who's a professional, who can really talk and understand your issues and tie in and actually help with that. That's probably one of the most important things here. And we're not saying that telebehavioral health, what this thing is going to be the replacement of your regular relationship with, with a therapist that sometimes carry over years in a variety of different cases. But we do believe that that is going to fundamentally change how people can experience and understand what therapy can do for them. And that's a pretty big deal, because you said a lot of things in life are becoming easier. There's a lot of other things about modern life that makes life significantly more difficult. So that's a reality too.
This is true. We have some community members weighing in. Jessica Lynn Jimeno. I see my therapist on Skype when I can't go in person. While I have bipolar 2, I also have chronic pain and autoimmune issues. Leaving the house is an autoimmune risk during flu season. And we then have Rona Barrymore, and she says, I've utilized the online doctor service that's offered through our health insurance. It was extremely convenient. The doctor even provided some reading material about my condition. This wouldn't have occurred in the doctor's office. Dr. Gentile, you are an online therapist as well, right?
Yes, we hear. I think Dr. Schoenberg makes good points. 1 in 4 Americans suffer from a mental health condition every year, yet only 1 in 8 seek care, which is, not a good thing. So access, affordability, accessibility, and stigma are all big things that prevent people from being able to get the care they need.
One of the things, Dr. Gentile, that I love about this, I'm very much like Joanne. I have a 3-year-old, 3.5-year-old, and I have a 6-month-old baby at home. So I was like, I need a mental health checkup. I'm going to see how things are going. So I went around looking for mom therapists, and I found this amazing woman, right? She had this great website. I said, this is the person who's going to help me figure out my life. And I shot her an email, this really positive email. And I said, hi, I'm a mom and I have a career and I'm just trying to figure everything out. And I was thinking I could come see you. Do you have any appointment soon in the evening, because I work and it's the only time I can come? And this mental health professional literally emailed me back one line, I don't have any openings. And I said, right now or for eternity? And she said, my evenings are completely booked up. This was devastating to me, and I'm not on the brink of a problem. I mean, I just wanted to have a mental health tune-up. What Joanna experienced and what I experienced are two completely different experiences. She was like, okay, I need a 9 o'clock appointment. There's where I can schedule it, and it was available to her.
Yes. It's quite unusual to be able to have an appointment within a few days with a provider of your choosing. In the community, usually it takes several weeks to several months to get an appointment. So you actually had a very typical experience in getting an appointment. So this is something unusual, and we hope that it's going to help the patients get the care that they need, whether it's stress, whether it's going through a divorce, whether it's the holiday season. We're here to help.
Right, Dr. Schoenberg, why? I'm disappointed that what I had was a typical experience. My brother's a mental health professional, and I forwarded him these emails, and he was like, this is basically unethical, but it must be nice to be in a situation where your schedule is so jam-packed, you just turn people away without even thinking about the ethical aspect of this. In some ways, this app basically evens the playing field for anyone who might be nervous about connecting, who might not know what to expect, who might feel judged or uneasy, to just have that experience in the comfort of their own home without being canceled or sitting in a waiting room, hemming and hawing.
I think you're actually on a very, very important point here. This is leveling the playing field. This is changing the playing field in a couple of different ways. We like to think about it really from, the bad experience that you've had, right? So people don't have a provider available to them. They don't have a professional that they can talk to. But think about what this does also on the provider side. So now you have healthcare professionals, because of the fact that they can do this, through technology, it means that they can deliver more care to patients. There's no way to produce out of nowhere thousands of behavioral health professionals and throw them into the system so that you won't have the experience that you've had. But if we can allow healthcare professionals to be available at a later hour from their home, for example, suddenly all of these hours will become available to patients. We're not saying that technology solves everything. It solves a couple of things. But in this case, the value is not only for patients by the convenience of seeing those healthcare professionals, it also allows more healthcare professionals to be available. And I think that's a dramatic value that sometimes get overlooked when you look at those kind of systems. It redistributes healthcare altogether.
Joanna, one of the things our commenters are mentioning is in the process of getting to the therapist and getting situated, sometimes you're late, sometimes they're running late. The amount of time you actually get to spend in a decompressed state working with your therapist is difficult. When you're at home, you basically don't have any prep for the time spent with a therapist. Do you feel like you get the most out of your time being in a comfortable setting already and not having to quote unquote get comfortable?
Absolutely. I mean, like I said, we were in the living room on our couch having just a one-on-one conversation with our therapist, and her specialty turned out to be infant to 5 years of age, so she was perfect for us. The follow-up as well was incredible. She was able to email us different resources, books, articles, just to be able to have, and the conversation has been ongoing.
Dr. Gentile, when we're talking about therapy and we're talking about mental health, many people have concerns about cost. For convenience, frequently cost increases. What happens with this app? What happens with online therapy?
So the way in which we're able to do it actually with very little overhead, for the Boston area, the out-of-pocket costs were less than half of that, and many insurance companies cover our services and other companies offer it as a benefit. So cost is actually something that's good on our side. Cost and access and availability. So we're fortunate in that respect. So cost is usually not a problem for folks.
And Dr. Gentile, and then Dr. Schoenberg, I want you to weigh in. One of the facets of therapy is it's complicated. By the time you get into an appointment with a therapist, it's so hard in person that even if you don't completely click, you kind of feel stuck. You're kind of just there. You're like, okay, I'm on this person's schedule. It's going to take me 6 months to find another person to schedule with. That you kind of just get stuck in therapy that doesn't work. With an online scenario, do people have kind of more agency to choose, to pick, to have more freedom to find the right person for them?
Absolutely. It's almost like a menu that folks are looking from. They can see a provider's picture, the experience, the languages spoken, the education. And that's not something, it's a lot harder to find that in the community. And it can often take weeks to reschedule that appointment, where literally you have the appointment with the provider, you didn't click for whatever reason, she reminds you of your Aunt Mary, who knows what that reason is, but they can literally get on the system and say, I still want help. I know my anxiety can get better, and make an appointment with a different provider.
I'll just add my 2 cents to this, and this is something that we've seen. So the system we're talking about is actually available also for medical care, for patients to actually see physicians for primary care and other reasons immediately.
Online.
And
so if I have a rash, I can just...
You can do that, or you can just use your phone and you will see a physician within 60 seconds. 24
Really?
hours a day, yes.
Within 60 seconds?
Just about.
It's like medical roulette.
It is, well, it's not roulette in the sense that you actually see good physicians. You can choose the one you want, connect with them, and in most cases, your health insurance will pay for it too, because it brings healthcare to your home. It's a pretty big thing. But what I was going to say is that the lessons that we've learned from, many tens and hundreds of thousands of visits on the medical side is that, funnily enough, the level of intimacy that you can generate by having uninterrupted one-on-one time from your home with a healthcare professional, where you're actually kind of close to each other, you're looking at each other's eyes, you're talking in very, very quietly. There are no nurses running into the exam room. You're not kind of rushed from one place to another. We have actually found that level of intimacy can actually exceed what happens when you are in person. I don't know why that is the case, but there's something about the focus that you have when you're looking into each other and the world around you disappears.
Joanna, part of that might be the fact that you don't have to put on pants. In the little webcam video, you don't have to see your dirty house, or the fact that you have breast milk on your shirt. It could just be a very close in on your face. Or I guess you don't even have to show your face at all, technically.
Absolutely. It's awesome.
Dr. Gentile, playing devil's advocate, though. As someone for whom mental health has touched my family very intensely, one of the facets of having the benefit of talk therapy in person is getting out of the house. Frequently depressed individuals or people dealing with mental illness have a difficult time mustering up the courage or the energy to get out of the house. Their therapist is one of the few people they will go to. How can we compensate for that aspect of mental health, getting vitamin D, getting sunshine, being interactive with other individuals in person, especially if you suffer from anxiety?
Yes. So that's a really good point. So therapists, we recommend things like things that can help with your diet, help with your exercise. So getting out of the house, we can help to help you with more natural supports in addition to doing therapy. So how do we incorporate that in your life? How do you go for a walk with a friend? So certainly that I wouldn't definitely not see that as an impediment. The benefit of overcoming the stigma of actually starting therapy, that I think that far outweighs any benefit that would happen visiting a therapist's office.
It's a great point. So, in many cases, like we saw from Jessica, do they have the opportunity? Do people have the opportunity to see you not only via Skype or via webcam, but also if they live in the area to meet you in person?
That's a great question. At this point in time, it's primarily via the platform that we have. We find that that's the most effective for patients, and since our therapists are seeing patients from all around the country, that we find that that's the most beneficial way for them to get care.
So how do we see this evolving? So right now it's working. You're having tens of thousands of individuals receiving mental health care, perhaps for the first time in a less anxious state. Where do you see this moving toward in the future?
Well, I think, if we kind of take a step back from the focus on behavioral health, what we see is that technology is becoming truly a channel by which people are becoming better. It's a combination of medical care and behavioral health, and in some cases it is wellness and understanding of healthy behaviors, get out of the house, helping people to understand that is important, they should do that. I think what we're seeing is the arrival of healthcare to the patient, where, for, hundreds of years, if we were sick or we needed help, we had to go to where healthcare was. And for the first time with technology, we have the ability to reverse that and actually envelope patients with the healthcare that they need in their own environment. That opens the door to so many different things, and I think behavioral health and helping people that are struggling with a lot of whether it's stress or anxiety or pain or chronic pain or debilitating diseases, I think the ability to use technology to bring healthcare to them is the arrival of a completely different look at how healthcare is acquired by patients.
When I see the benefit of this, I can't help but think globally, where you have individuals who have very low income, who are risking everything to cross borders, to go to countries like Thailand that have better health care, to help their children, to help themselves access anything for their health. Do you see there being a nonprofit component to this, or a component to this that brings this technology to a more global scale?
Absolutely. I think, unfortunately, you don't have to cross borders to see areas within the United States where people are deprived of good health care. Sometimes the challenge is because they live too far. Sometimes it's because they're homebound. They have, there are different conditions that prevent them from going out. Sometimes they don't have the right health insurance, which makes them not seek help. And sometimes they just don't know what's available to them. So the reality is, whether it's, and we can go into all discussion about the Medicaid population, everything else. Even here in New York City, you have healthcare deserts where people don't have the healthcare that they need. So I think getting people, whether it's philanthropic based, whether it's overseas, or whether it is within the United States, the ability to project healthcare to where they are is going to dramatically change how we can help those people.
Joanna, speak to that, because again, you're studying to be a nurse, right?
Yes.
Do you think that having had this experience from the patient perspective via webcam, can you see you being able to provide your services as an expert?
Absolutely. I mean, I think that's one thing that drew me to the app, just the fact that I am studying to be a nurse practitioner. It would be great in the future to be able to utilize this resource and actually, in turn, become a provider to patients seeking help.
Well, we have a question here, Dr. Gentile. I need you to advocate for your case. Is a robot therapist something that we could expect in the future? Now, we're talking about changing lives and making it easier, but there's still something to be said for human-to-human contact, right?
No, thank you for a robot. No, studies show over and over again it's the relationship that's most important in getting the patients better, regardless of the therapeutic modality. So no, thank you.
All right, well, we're grateful to our guests. You can read more about Amwell's online doctors and web therapy by clicking on the links in our resource well below. Make sure you stay tuned because there's so much more coming up here on HuffPost Live, where, as you know, the conversation always continues.